there's a difference with security teams with being a sprint versus a marathon.
Sure.
Could you articulate on that?
We're geared towards the incident, right? I mean, it's kind of in our mindset. It's in our DNA. It's what makes us, those of us that are sort of in that space, like really good. So you think about like when that moment happens, how to surge up to deal with the incident, deal with the hack, deal with the compromise, whatever is going on, and those tend to have fairly distinct time boundaries. It's the discovery of what happened, it's the containment of the issue, then getting into the long tail of eradication and recovering yourself from all of that. And there's a lot of excitement. I mean, there's adrenaline that gets into an incident that happens initially, and it gets a little tiring, as time goes on, depending on the severity of that. So that's all fine. And I think, probably everybody who's listening can think about when this whole thing started, everybody surged, and it was that feeling, that muscle kind of came out again. And then after a couple of weeks of this, everybody started getting tired, because you can't run on adrenaline for weeks and months at a time. And so, when I think about this in sort of like the early stages of COVID, it was a very quick, the incident, here that we're talking about is bringing the organization through all of the things that we just talked about and making sure all that stuff is happening, quick, rapid assessments that had to happen from a risk perspective, major changes on your security platforms, new vulnerability, new visibility options that you didn't necessarily have before, new sensors that you're throwing out. I mean, there's just a scramble, to get stuff in that you had maybe had on your plans for 2, 3, 4 years out, on the roadmap, and everybody's kind of going, oh my God, we got to do this all right now. I think that again, the early stages of that, the scramble was fine, but then very quickly it was, you've got to really truly understand where the team is at, what their level of capacity is, and where the level of exhaustion is. Making sure that everybody's, I think the communication on this was really important, so communication and roles and responsibilities of every individual and what they're supposed to be doing, like reducing that ambiguity really helps de-stress sort of like what the thought is of what the individual what they were responsible for delivering on. And then ultimately, we had to get into a new cadence, so we're home. There's how are we going to maintain our social interaction and our and our connection that we had? And so there's new techniques that were being used, between like daily stand-ups on Zoom, or new instant messaging platforms you have to set up.
It's a whole new world out there, isn't it? And
totally.
And so, but Errol, I thought we were promised by the attackers, the gangs, the criminal gangs, that they were going to lay off the hospital systems during this pandemic. What happened with that?
Yeah, I think that promise was in place for like all of about 24 hours or something like that before we saw like any real solid activity against that. But an interesting way to bring that up, because I think that was sort of the final straw with some security researchers, and they really hated to see what was happening with hospitals and healthcare delivery organizations that were becoming victims of ransomware during this COVID pandemic response time, and got fed up with what the criminals were doing. So they decided, hey, what can I do to help? And so they gathered people together, and we have circles of researchers that are volunteering their services in all kinds of ways. And so there's an organization, for example, called the CTI League. They've got over 1,000 security researchers that are contributing work on a daily basis. We're on an active Slack channel with them. And so there's a lot of great information sharing going on. We're sharing IOCs, they're sharing scan reports of vulnerable healthcare infrastructure that we, Health ISAC, are able to notify those organizations that they may have a potential problem. And then we're also fielding fake websites and malicious website takedown requests back to those security researchers to help us with all of that work as well. Another similar organization called the Cyber Threat Coalition. And then the last one that I want to just mention also is another group called Project N95. which I think is really neat because they stood up to help get PPE equipment into the hands of our first line responders and our medical professionals that were trying to get PPE equipment to deliver healthcare. And so it really is about this project95.org is all about matching up vetted suppliers with people who need
Yeah.
the PPE.
I think that's one thing we've seen over and over is the groups that are stepping up. I know some organizations that have donated their time for open source to make open source ventilators and things like that. So a lot of good things going on.